One. The open meeting law requires that I notify the public that this meeting is recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made by Boston City TV, a part of the City of Boston Office of Cable Communications, and is being broadcast on Xfinity Channel 24, RCN Channel 13, and FiOS Channel 962. Now, we do have some spoken language interpreters who are here tonight, so I'm going to ask them to introduce themselves and to explain the interpretation channels, and then we will open them. Emily, would you like to start with Spanish?
Good evening. My name is Emily Getchell, and I will be the Spanish interpreter this evening. Buenas noches a todo el mundo. Mi nombre es Emily Getchell y voy a servir de intérprete para los que están escuchando, que desean escuchar en español esta noche. Primero le queremos dejar saber que esta reunión se está grabando y si usted no quiere estar grabada, por favor, quita su cámara y su micrófono. Se está grabando en cable 24, RCN 13 y FiOS 962. En un momentico vamos a encender la función de interpretación, entonces se puede ubicar al fondo de su ventana de Zoom y ahí hacer clic en el botón con el globo que dice interpretación, de allá escoger Spanish para escuchar la reunión en español. Si te está conectando tras móvil, empuje los 3 puntitos, escoge Interpretation, pues Spanish, pues Done o Listo. Si tiene cualquier dificultad, por favor, comunícase con nosotros tras el chat. Muchas gracias. And now I pass it over to our other interpreter.
Melissa, would you like to go next?
Sure. Good evening. My name is Melissa Lopes. I will be the Cape Verdean interpreter, and I'll start my introduction. Boa noite, meu nome é Melissa, saber ser intérprete de língua cabo-verdiana. Eu queria deixar saber que a reunião de hoje está ser gravado. Está ser gravado para 3 diferentes canais de televisão e, portanto, se nós queremos ser gravado, por favor, nós podemos trazer a câmera e também, quando nós temos acesso a serviço de intérprete, nós podemos ver ali onde que nós temos globo na ecrã, nós calca lá onde que está a opção de língua. Nós calca então na Cape Verdean, ou seja, língua cabo-verdiana. Se você estiver na telemóvel, por favor, bota bem na 3 pontos, onde que bota calca na opção interpretação ou interpretation e bota calca naquele nome de que língua que você, que nesse caso é língua cabo-verdiana ou Cape Verdean. Se você tem alguma pergunta, por favor, que você hesita de contactar através de chat para não poder continuar a ajudar. Obrigada, então boa noite.
Thank you very much. I have now opened the interpretation channels. For those of you who do not need interpretation into a language other than English, please still click the globe for interpretation and select the English channel. This will allow you to hear any comment from those in the other language rooms. When we get to public input, the interpreters will join us in the English room to translate into English. So I'd like to now ask everyone to make a selection of a language, either English, Spanish, or Cape Verde Creole. And finally, I would like to make one more note about logistics before handing it off to our board chair. This meeting is being recorded, as has been stated. Closed captioning is available. You can access it by clicking on the CC button at the bottom of the screen. If you have trouble accessing it, please chat the Disabilities Commission staff for assistance. ASL interpretation is also available. If you would like to have the ability to multi-pin, again, please chat the disability staff for assistance. Remember to refrain from interrupting interpreters. Please allow time for them to finish translating before speaking, especially because we have 2 simultaneous consecutive interpreters. According to the agenda, which will be shared in the chat, public input is near the end of the meeting. If you have a question or comment before that time, please use the chat function. If there is time, we may be able to answer your question before the public input period. Please mute yourself when you are not speaking in order to minimize background noise. Please identify yourself before speaking. This increases access for our blind or low vision attendees. And finally, please use the Zoom raise hand function if you wish to speak, and wait until you are recognized to begin. This gives us time to pin you to the screen, which increases communications access. If you have difficulty with the Zoom raise hand function, please feel free to raise on camera or use the chat. And with that, I will hand it to our board chair, Wesley Ireland.
Thank you, Andrea. Thank you, everybody. Good evening, everyone. I'm going to go ahead and begin with our agenda for tonight. So I'm officially calling the meeting to order. And I'd like to begin with, first of all, introductions to all of the members. I'll introduce myself first. I'm Wesley Ireland. I'm a man, white man. I use sign language. And I have 2 female sign language interpreters who are interpreting for me, so you hear their voices this evening. I am the the advisory board chairperson, and I'm going to now call each member of the board to please introduce themselves. So first of all, I'd like to call Jerry. Sorry, Jerry, that was a misinterpretation. Jerry, go ahead, introduce yourself, please. Jerry, make sure you're unmuted, please.
Yes, okay. I guess for whatever reason, the host had to unmute me. Sorry about that. My name is Jerry Boyd. I am a proud member of the advisory board, and I live in West Roxbury.
Thank you, Jerry. Okay, next, I'd like to see if Charlie could introduce himself, please.
Hello, everyone. My name is Charlie Kim. I'm a resident of the North End, and I'm a member of the Disabilities Commission Advisory Board.
Thanks, Charlie. And next, Paulette, please.
Everybody, my name is Paulette Durrett, live in Mattapan section of Boston, and I'm an advisory board member.
Thank you. And next, Richard, please.
Hi, everybody. Richard Glevsky, member of the advisory board from Mission Hill, Beacon Hill.
Thanks, Richard. And next, could I have Olivia, please?
My name is Olivia Richard. I am a member of the advisory board, and I hail from Brighton.
Thank you, Olivia. And Carl, please.
Yes, hi, my name is Carl Richardson. I am a person that identifies as deafblind, and I live in Brighton. And I'm also the treasurer.
Thank you. Thank you very much. Okay, Lucia, could you go ahead next?
Thank you. So good evening, everybody. My name is Lucia Lebovskaya, or Lucy L for short. And I am So I'm the vice chair, and I live in Boston and Mission Hill specific. Thank you.
Thank you, Lucia. Next, could I have Paul?
Hi, my name is Paul Karen. I serve as the secretary of the advisory board. I live in Boston, Mass. And work at the Boston Planning and Development Agency. Thank you.
Thank you. Next, can we have Alice?
My name is Alice Fisher. I'm a member of the board, and I live in the south end of Boston.
Thank you, Alice. And next, could I have Elizabeth?
Yes, hello everyone. My name is Elizabeth Jean Fowler. I'm an advisory board member and I live in Back Bay.
Thank you, Elizabeth. Now, I'd like to give the floor to Commissioner McCosh, please. Commissioner? Oh, there she is.
Hi, everybody. I'm Krista McCosh, and I'm the Disability Commissioner and ADA Title II Coordinator for the City of Boston.
Thank you. Okay, now let me see if I have gotten everybody. If I've missed anybody. Is there anybody that I've missed who might be joining us on the phone? Okay, I don't think I have. Great. All right, thanks everyone. Now I'm going to go ahead with the next item on the agenda. Yes, okay, so we'll move to approval of the minutes from the last meeting. Who would like to make a motion? Who wants to open it up? Or if there's any open for discussion about the minutes from the last meeting? I see Olivia.
I make a motion that we approve the minutes for last month.
Is there any discussion needed? Okay. Seeing none, would anyone like to second Olivia's motion?
This is Carl, I second.
Okay. All right, all in favor, please raise your hand visually. Or say aye.
Aye. This is Carl, aye.
Okay, thank you. Any nays? Any abstentions? Anyone abstaining? All right. So the meeting minutes from the last meeting have been approved. Thank you, everybody. So just one moment.
Laurie, could you please try to speak a little louder?
Yeah, 1 second, please. I'll inform Wes. All right, Richard, let me know if you can't hear me. Is this better? Is this better?
Yes.
Okay. Sorry, I'm trying to pull up my window and to see the agenda. I've got it now. Okay, it looks like we have a presentation talking about accessibility efforts. Fenway Park, but that person apparently is sick. So Andrea, thank you for letting me know. Andrea was able to actually at the last minute, rather than have our intentioned presenter, we're having somebody from the Office of Food Justice who is going to be here today. And we have Pei and Kim with us. So I would like to give the floor over to Pei Yin.
All right. Hi, everyone. I'm Hayen. Pronoun she, hers. Does the sound okay? Okay, cool. Yeah, I'm with the City of Boston Office of Food Justice. And the mission of the office is to establish a sustainable, resilient, just food system in Boston. So last year, OFJ, which is what our office is called, the short term, we piloted a program to where we work with 5 local organizations to build 280 raised beds for food insecure households in Boston. And this year, we're working with Boston's Urban Ag Office, which is called Grow Boston, to expand this program. And the raised bed program is going to work for the next 2 years, and will provide basically local food sources for low-income households and increase people's capacity around gardening. So we are working with external and internal city partners to get referrals for this program. So the intended recipients are low-income, food insecure residents in Boston. And we're really excited about this opportunity because it will also be paired with gardening education. So we haven't rolled out, there will be an application that we can share with Andrea. We haven't rolled that out yet completely, but we are receiving referrals from the Age Child Commission and maybe a couple other city departments who are constituent facing, and then working with health care centers who are doing the food insecurity screening that way. And we're hoping that doing this kind of targeted outreach will make sure folks who don't have the opportunity to get this kind of resource are able to access it. So we're really excited. Thank you, Colleen and Andrea, for inviting us to speak today. Just a couple of comments on eligibility. So with regards to eligibility, recipients will be low-income Boston residents who have experienced food insecurity within the past year. The recipient's home address must be based in Boston. And the third thing, which is a little challenging, is that residents either need to have permission to build on the site that they want the raised bed to be installed at, or they need to be the owners of their property so they can build a raised bed. I think we still want to hear from folks who want to grow, but maybe either don't own property or don't have that from their landlord. Because there's a lot of opportunities to increase growing capacity in Boston for residents. It doesn't have to be the raised bed. It's potential that Grow Boston could think about okay, community garden would make more sense for this community. And so I don't want to tell this as the only way people can grow in Boston, but it's just one option. And for this option, folks do need to own the property or have permission to install it. And in terms of timeline, folks can request a bed for this summer 2024, or next spring this summer 2023, or next spring 2024. And we'll start screening applicants in May and early June. So I think that's the background. I'll definitely send along a flyer that will be translated as well as the application. The application question has a question about accommodations. I think last year that was something that the vendors were able to integrate. Yeah, and I see the question about the raised bed. So raised bed is instead of a garden that's in the ground, it's a growing space that is elevated above the ground. And so a couple of things, ground, there are concerns with lead, right? So like we want to make sure that the soil that people are growing in is safe to grow food in, so it's not actually in the ground. And then I think for accessibility reasons, like often they are higher off the ground, and I think like the height and the exact size can be determined based on folks' needs and like based on like the location itself. But that's what a raised bed is. So it could be like a smaller. I don't even know what the right dimensions are, but it's something where you can grow a good amount of food in, but it's like off the ground. That's accessible to folks in the way that they need it. Yeah, I will say also, I think we're extending the invitation to community organizations. So if folks themselves don't have property, we have built these raised beds for community orgs in the past who have opened them up to gardening for the community that they serve. But yeah, that's the background. I will leave my email and the contact information. So if anyone has questions, feel free to ask me. But I will send the materials once they're translated and everything to Andrea so they can be shared out. And we hope to hear from folks.
This is Wes. Thank you so much. We really appreciate you being here to speak about this. Does anybody have any questions for Hyen while she's here? Olivia, I see your hand raised. I think there is a question. Olivia, did you have a question?
Yeah, I put my question in the chat. I was wondering whether someone can maintain a raised bed for someone else who has a disability who can't garden on their own.
Yeah, that's a great question. I think there's a couple ways that could happen. Either it could be a community plot where like a community org is maintaining like the grounds. That could be something, yeah, I think there's space in the application where if folks want to put that information, so like I think the question for us mainly is like, where should this bed go? So like, and then how it's utilized, like that's definitely, I think, something we can talk about. And like, I think it would depend if someone already had someone that wanted to garden together, or if folks would need like external support. So this external support part, then I think a community org might be the better way to go.
Thank you.
This is Wes. Any further questions for Hyen? Okay. Then I want to thank you very much for your time. We really appreciate you coming this evening to give us some insights into your program. Thank you so much.
Great, thank you so much. I'm gonna hop off. Have a great rest of the meeting.
Okay, thank you. All right, moving on in our agenda. Our next item is the chair's report. I have to tell you very honestly that my chair's report this evening will be short and sweet because I actually have nothing to report. So there you go. Now we can move on to Commissioner McCosh's report. Commissioner McCosh, when you're ready.
Thank you, Wes. I believe Andrea is going to share the slides. Great, thanks, Andrea. All right, so my report tonight is also fairly brief, but I will begin by letting everybody know that Mayor Wu has announced her coffee hours for 2023, and we'll have the dates up in a moment. Here we go. Okay, so as you can see, the mayor is squeezing in a lot of coffee hours this year. It's an annual tradition that the mayor does every spring to get out into the community, meet folks in their neighborhoods. The Parks Department gives out plants. So it's a great event where you can come out, meet the mayor, meet other city officials. A lot of department heads will attend. My staff and I usually attend different coffee hours. They are in most neighborhoods, and we didn't put down the location, but there is a website where you can get more information. I will ask one of my staff to put that in the chat. But they are really great opportunities to get out and have some face-to-face time with your local officials. So I would encourage everyone to attend, especially if you haven't attended before. So again, they begin May 2nd and they run through June 21st. And you can see the neighborhoods that are listed here where they will be occurring. Great, next slide.
This is Andrea. Apologies. I'm going to need to start over. It was giving me trouble.
No problem. And while Andrea's doing that, you can see that Chris Morawski, our staff specialist, has posted the link to the coffee hours in the chat. So come on out and get a free plant and meet Mary Wu. Okay, the next slide talks about 2023 Disability Commission events, things that my department is working on. So two of our main events happen in the spring and summer. The spring, we have our annual Disability Community Forum. So that is scheduled this year for Thursday, May 11th. It's going to be in person live at Suffolk University Law School. They have a really nice, large, accessible space on Tremont Street, very close to Park Street Station. So we invite you all to come out. It's on Thursday, the 11th from 2 to 3:30. We'll also have a virtual option, so watch out for a Zoom link to be posted soon. This is, like I said, it's an annual session for residents to give us input on their priorities and concerns. It helps us shape our agenda for the next year of what we need to work on, what's working well. It's a great chance for residents to come out again and meet officials face to face and get to give direct input. The mayor usually attends, many staff and department heads attend, and it's traditionally hosted by myself and the advisory board. So I'll send an email out after tonight's meeting to get RSVPs from everybody. But if you haven't attended before, the format is that we put tables up front in a conference style, and we sit at the front, we have microphones, and really we don't do too much presenting. The only thing that is presented is I go over the annual report from 2022, which I've compiled, and just to give kind of a snapshot of the things that the department and the board has worked on over the last year. So I'll give a brief overview of the annual report, and then we'll really just listen to people's comments. It's a great event. We usually get a great turnout. So if you are available, we'd love to have you join us as board members. The public loves to meet appointed officials, such as yourselves. So it's a great chance for transparency and involvement with the community. So I hope you will all be able to attend. I know it's in the middle of the workday, but this is the time frame that we figured would work best for the disability community. And if you can't join us live, you're welcome to join us virtually. So keep that date in mind. And then our biggest event happens every summer in July, right around the time of the anniversary of the ADA passage. So this year it will be July 18th, and it's going to be ADA Day. It's from 12 noon to 2 p.m. on City Hall Plaza. This will be our first year on the newly built Accessible Plaza, which was opened up for business as usual in October. So it's been a long redesign and a reconstruction project of the plaza, but now it's a beautiful accessible space. So we're thrilled to host ADA Day in this space because, as many of you may remember, previous renditions of the ADA celebration have been on cracked bricks and cracked concrete, and just very non-ideal conditions for accessibility. So we're excited to kind of show off the new plaza and celebrate ADA Day. If you haven't been there before, we have information tables from disability organizations and also from City of Boston departments. You can register to vote. You can learn about neighborhood services, who your liaison is. We have organizations like BCIL and Easter Sales. Spalding sometimes brings adaptive rec equipment. It's just a fun celebration. We have food, music, t-shirts, lots of time for socializing. And we also have a speaking program where we recognize an outstanding partner in accessibility and inclusion from the last year. And this year, we have a special edition. We're going to be launching our Boston Breaks public education campaign to talk about the intersection of pedestrians with disabilities and cyclists. So it's going to be a jam-packed event, and we hope you will all put it in your calendars and plan to attend. And also spread the word to your communities. And next slide. So for my monthly reports, I decided to change my format a little bit. I'm going to focus on one main update every month instead of trying to give multiple little updates. So I'll do one in-depth update every month. Sorry, if everyone could mute, that would be great. So this month I'm going to talk about the work we're doing on economic mobility for people with disabilities. So economic mobility is one of Mayor Wu's top 5 priorities, and it's also one of the Equity and Inclusion Cabinet's main 3 top priorities. So economic mobility for people with disabilities, what does that mean? So as we know, the ADA has been very successful in making a lot of accessibility improvements, but one place where it hasn't done a great job really is improving the economic mobility of people with disabilities. People with disabilities primarily still live in poverty. They still have low employment numbers. It's just a lot of barriers still exist in this realm. So we're working to increase systemic accessibility in the city of Boston in several ways. So we're looking at contracts. We're looking at ways to support disability-owned businesses. The city currently has a priority of awarding contracts. They look at minority-owned businesses, women-owned businesses, and we're trying to get a priority status and potential certification for disability-owned businesses. That would give people with disabilities who own their own businesses a better shot at getting a city contract for work. So that would be something that we're working on this year. We're also looking at reviewing city procurement contracts to ensure that everything we purchase is ADA compliant. This would be something like, say, a website, or the 311 app. We usually contract out to different vendors for things like that. So we want to make sure that the language is clearly spelled out in our contracts, that any products they deliver to us have to be ADA compliant. So something like the 311 app would have to be compliant to a screen reader. It would have to have visual contrast that would work for somebody with low vision and things like that. So that sounds like a simple thing, but if it's not written into the contract language, it could potentially get missed. So these are the type of systemic access issues that my department works on. So it will have a big impact, and we're pursuing avenues like that for on the city end. We also have worked a long time to create an accessibility toolkit, and this is meant to increase accessibility in small businesses outside of the city's governance. It's meant to help small businesses on main streets and organizations and nonprofits. So we created a pretty robust toolkit, and we actually were able to share it last month with the National Main Streets Conference, and we're rolling it out internally, externally in Boston through Boston Main Streets, the city's Department of Economic Opportunity and Inclusion, and our agency partners. So the toolkit includes several different checklists. The first one is an accessibility self-assessment survey for businesses, agencies, and organizations. This is a really simple checklist. It's about 10 pages long, but you don't need to be an architect, you don't need a ruler, you don't need to have any knowledge in order to complete it. It asks basic things like, is the front entrance of your business accessible? And you can check yes, no. Things like, is the sidewalk in front of your agency or business in good condition, or is it cracked and broken? So then, once this survey is complete, we offer a low-cost, free and low-cost solutions for barrier removal tips. This is some things that they can do for free or low cost. Things like if the sidewalk is cracked, put in a 311 report and the city will make safe repair or replace the sidewalk. If you only have one step, think about purchasing a portable ramp. So real practical, free and low-cost solutions to improve access. We also have guidelines for temporary structures, things like sidewalk sales, pop-up events. We have guidelines spelled out so they don't end up in the middle of the path of travel, so that there's clearance to get in and out of the pop-up tents and things like that. Then we've created a meetings and accessibility checklist, an outreach and engagement checklist. These are for both internal and external. We give them out to city departments, and we also spread them out to the public. So these are all links. I invite you all to click on them and see the kind of work we're doing. The last thing we do is, in the toolkit, is tax incentives for barrier removal. And this is something that businesses and agencies can apply for. If they have taken steps to remove barriers, they can apply for tax incentives. And one other thing that we're working on, I didn't have room to put it in the slide, but the city of Cambridge has an ordinance that requires barrier removal that's readily achievable. So currently that is required by the ADA as a civil right, not so much as a building code, but as a civil right. Any Title III entities, which are businesses, are required to remove barriers as long as it's readily achievable. However, compliance for that is based on complaint. So someone would have to ask, oh, I can't get into this, I can't get over this threshold. Could you please buy a threshold ramp? And then the company would be, the business would be obligated to remove that barrier. However, the Cambridge ordinance makes it proactive, that stores have to identify barriers and remove them as long as it's readily achievable. So we're looking at potential language for an ordinance on that. And then also, Cambridge has a grant program that gives a matching grant for businesses that do improve access. So we're at the very beginning stages of these conversations, but those are two other things we're working on for economic mobility in the coming year. So that's it from my report. Like I said, I wanted to do a deep dive on kind of one project that we're working on every month. I know last month we talked about the disability commissions across the country that we work with. So this month I wanted to update you on economic mobility, and I'm happy to take questions.
And the interpreters are switching. Hopefully you can hear this interpreter now a little bit better. Yep, great.
So Commissioners, the focus on employees having access to the workplace.
So if it's a Title III business and it has like one step or things like that, or anything that can be solved with our free and low cost solutions, that would certainly increase employment opportunities for businesses. But I know separately that disability advocates, including those in my office and Mayor Wu, have gotten behind the state legislation that will update the AAB regulations to include accessible employee areas, because right now they're not included under AAB. They are part of ADA, but they're not part of AAB. So that's a great point. Certainly access to employment is a huge piece of economic mobility. So in short, yes, but in long, we have to do it through many different channels.
Okay, Elizabeth, go ahead, you have the floor.
I think I was just trying to unmute. Thank you for your update, Commissioner Akash. Two quick questions. One of them for the self-assessment tool. So that's just something an agency could choose to do internally. If, in other words, if it pertains to businesses or agencies that already exist, and just kind of as an FYI, or I guess what I'm trying to think of, if some agencies or organizations meet those criteria, they might be more willing to take, you know, to look that over, but be satisfied with where they are. But I'm just wondering how that works, or how that's, is there an educational piece, or what?
Yep.
How does that work in other settings? where
That's
there
a
might
great-
be issues?
Yeah, that's a great question. Andrea, would you be able to pull up the checklist, just the first paragraph, so we could refer to that, because that kind of gives a good explanation of the reasoning and the ideas with the checklist. If you're not able to, that's fine. But basically, the idea came to us because a lot of City of Boston departments give out grant money. Things like the Arts Commission gives out mini grants to different artists and different arts communities, different programs in Boston. So during a conversation a couple of years ago with the Arts Commission, I asked about the accessibility of the venues that they give grants to. And they really didn't know about what the access was. So I said, it would be great if we could figure out a way to assess the access and monitor it. So this is the first page. So it's a really good explanation. So this survey is intended to help agencies, organizations, and businesses identify existing barriers that may prevent people with disabilities from participating. Once the barriers are identified, you may be able to make free and low-cost changes, which we can help identify. And then they can also start thinking about longer-term plans around ADA compliance. We asked them to take a look around their space before they begin the survey, just so they have an idea of like what the front door looks like, what the bathroom looks like. And then we do want to make it clear that the survey is intended only for their benefit and use. The information will not be used to issue fines. We like to say we're not the ADA police. We have inspectional services to do their job. But this is really just to stimulate some thinking and creative solutions on ways that they can improve access. Things like, say it's a dance program in Mission Hill. And again, they have that one step in like an old veterans post that they use. So maybe they could think about purchasing an accessible ramp. And just to circle back to the beginning of the question when I said we work with the Arts Commission. So if the Arts Commission gives out 10 mini grants a year, we ask them to distribute this survey along with the grant funding to have their agencies that they work with fill it out, share it with the Arts Commission, and then us, and then just keep it for themselves. So it's definitely an education component. It's also a chance for them to start thinking about access, and it will give the Arts Commission and us a sense of how accessible the programming is that we are working with. And it can also potentially, again, beginning stages, we're just rolling it out now, but we could think about ways to offer incentives, to hopefully improve access. And another organization we want to roll this out with is like the Freedom Trail. Like they have a number of churches, they have a number of museums, there are just, houses and other buildings along the Freedom Trail, but there's no chart really that tells how accessible those places are. So this would be a great place for them to self-assess. And plenty of big businesses that are on the trail, like, the Old South Meeting House or the Paul Revere House. We know that big organizations, institutions think about access and have ADA specialists. This is really more for like smaller nonprofits who don't have a lot of money, just to help them kind of think about it. It's like an initial tool to kind of do a big assessment before they do any work.
Okay, thank you. And is there any non-incentive, non-monetary? I know you mentioned about that there might be some sources of funding, or you could help direct them to it. Otherwise, is there any other being able to, maybe this already happens, but say having the universal wheelchair logo sign or something, that may not, that would, especially if you're talking about visibility or with social media or things like that, other ways they could see this of benefit.
Yeah, I would really encourage everyone to look at all the links, because in the accessibility meetings and events checklist and the outreach and engagement could be for city departments as well as businesses. And on those checklists, we say, like, does your web page contain information on accessibility? Do you use the accessibility symbol, like in your window or on your, in your outreach on Twitter? If you've done an assessment, like, do you promote that? Do you market your things to people with disabilities? So there's all kinds of tips and tools to encourage people to do that. But yeah, again, I would encourage you to look at all the links, because I think it will be pretty helpful. And also, we have worked with Age Strong. They have what they call Age Friendly Boston, I think. I think Andrea has worked on this a little bit. Do you want to give a brief overview of that?
Sure, thanks, Commissioner. Yeah, Age Friendly Boston is a big part of the Age Strong Commission's work. One of their particular projects is called an age-friendly business designation. So they get a list of, I'm making up numbers here, but let's say it's 25 items that they can pick from. And as long as they do 10 of them or 15 of them, I forget exactly what the numbers are, they can receive an age-friendly business designation. So what that means is some signage in their shop, at the door. They get listed on the Age Strong Commission's website as an age-friendly business, and that includes a number of different things, including, actually, before the captions ordinance was passed, it included having captions turned on automatically on their television, if they had one. So that is the age-friendly business designation program.
And we've talked about making a designated one for our office too. So again, it's in the beginning stages, but we definitely are thinking along those lines.
Great. And also, are there any other questions here for the commissioner to respond to her report? Anyone else have questions for the commissioner? I'm a little bit confused, Elizabeth. I do still see your hand raised. Is that new or is that old? Do you have another comment?
I did have, thank you for, I took my hand down in case other people had questions, but the second question I had was unrelated, and I frankly don't know if it belongs under here, or I don't know if it would be called necessarily new business, so you and the commissioner can help me sort that out, Leslie. But it had to, at the end when you were mentioning, Commissioner, about the issue of workspaces for employees with disabilities that comes up yearly at the state legislature and still hasn't been, I don't know if we're now at the 2-decade mark, about 20 years of trying to get that passed. But I was curious to know, and I don't know if Carl also might be able to give us some help, but how that looks for what we might be thinking ahead for our participation in the next session of the legislature for that bill.
For the bill, yeah. So I know that in the past the board has written letters to support it, obviously. I know a lot of you have testified individually. I've testified. My architectural access staff has all testified. Like you said, it's going on 2 decades, which gets really frustrating. It just seems like, a no-brainer to most of us, but unfortunately some of the real estate groups have strong lobbying power and can push back about some of these regulations. So again, we will be involved once it comes up. I don't know if Carl's on, if he knows the status, or Andrea. I'm not in the weeds on dates and filing, things like that, but if Carl or Andrea, please feel free to jump in.
This is Andrea. I haven't seen Carl unmute, so what I'll say is I have not tracked this particular bill number in the new session. If I had to guess, because I know that the sponsors and authors are still in the House and Senate. The ones who've been reintroducing it every year are still in office. My guess would be that they have reintroduced it. A lot of bills have been assigned to committee lately, so it may or may not be in committee. But we're still in early stages and about to enter budget season, so my guess is it isn't scheduled to have a hearing anytime soon. But I will triple check all those numbers and work with Carl to have an update at the next board meeting.
And we work closely with our Intergovernmental Relations Office, which is the office that works with the different government bodies, because we're strictly like mayor's office staff. So we have to go through IGR to work with the city council or our state partners or our federal partners. So we work very closely with IGR to pick out the bills that we want to prioritize for the mayor. And certainly this is one that we prioritize every year. And the mayor always signs off on it and writes a letter in support of it. So yeah, we will update you next month. We'll put that in old business.
Okay, thank you.
Okay, I see Jerry has a question.
Yes, just a brief question, Commissioner. Have we gotten any feedback on on how businesses are taking to the captioning ordinance? I know initially you thought feedback was good, but I just didn't know if we've had an update, a few months more in.
Yes, so we haven't done any sort of official surveying or anything like that of businesses. We haven't received any complaints, which is a good sign. And now when I'm out and about, I sort of take it for granted. Like I was out to brunch Sunday, and I just noticed halfway through that the TV had captions. And the only reason I noticed it was because I was actively reading the captions to listen to the news. And then I realized, like, oh my God, this caption's on. So it seems to me like every place I've gone into, they are abiding by the ordinance. But anything I could say would be anecdotal at this point. I did have it on my agenda to circle back with Andrea next week to talk about either some more outreach to businesses or a potential survey. But as far as I understand, we haven't received any complaints, and it looks like a lot of businesses are in compliance. Andrea, do you have anything to add to that?
This is Andrea. Nope, that's exactly what I would have said. I guess I do have one thing, which is the business card that we are getting printed to give members of the public to have in their wallet to show a business if they see that it doesn't have their captions on, is in progress. So that is still happening, just caught in the weeds of procurement deadlines.
This is Jerry again. That will be a very useful tool, and it's a good sign that there have been no complaints, and it's good. It's good just from anecdotal evidence that you see that businesses are having captions on. So that's great.
We're going to switch the interpreters again, Andrea.
This is Wes. I'm thinking about the captioning ordinance as well. I have noticed actually very few places that are not in compliance, which is also a good thing. I can see, places where I've gone to see out the window, for example, places I haven't gone into. I know that there are some locations that are going to need to be gently nudged or not so gently nudged. But I have seen a lot of restaurants in the North End, particularly, that have the captions on. So I think that's terrific. I echo everyone's sentiments about that. Okay, let's see where we are. Any further questions for Commissioner McCosh's report before we move on for the next item on our agenda? Okay, seeing none, Commissioner McCosh, thank you so much for that report. We will move on. We have the Architectural Access Report by Patricia Mendez.
This is Andrea. I think Patricia was unable to join tonight with technical difficulties, but I know what she had planned to say was thank you to the members of the board who joined the advanced CAM training, the ACAM training. I know we found it really helpful. We hope you all did as well. If there are other trainings that you would like, let us know. And if you would like to use your newly trained selves and do a subcommittee of this board to look at architectural access issues, I know Wes gets the variance applications for Boston applicants. So if you all want to have a subcommittee, Patricia would be happy to chat with you all about that. So that was her update. Apologies that you could not get that from her.
This is Wes. Thank you, Andrea. All right, next on our agenda, we have announcements. Anyone on the board have any announcements they'd like to share?
Wes, would this be an appropriate time to mention,
Yeah,
So-
go ahead, sure.
So, I think we all recognize that mental health is also a disability challenge that people face. And on May 6th, which is the beginning of Children's Mental Health Awareness Week, the Baker Center for Children and Families is having a walkathon, if you will, on Fielder Field at the Esplanade. It's a Saturday. It's a family-friendly event. Kids are invited. It's very modestly priced. Adults are $25, students are $15, and those who are 18 or under are $10 to attend. It sounds like it's going to be a lot of fun. We're planning a lot of activities for children. There is a 1K opportunity to walk, roll, or run, a 5K opportunity. It should be very nice, and it would be a way for the commission, to the extent any of you are interested in attending, to make our imprint a little bit on the mental health challenges of children, which, of course, they're the next generation that we need to care about. And I think we all know how mental health is, unfortunately, the stepchild of the healthcare industry. So I think anything we can do and highlight that, especially for kids, is pretty laudable. So if anybody wants the information on that, I'm happy to send it to the commissioner to circulate, or to any of you individually. I think it'll be a very nice event, and hopefully the weather will hold.
This is Wes. Thanks for that, Richard. Thank you for sharing that information with us. Do we have any other announcements? Okay, seeing none, we can move on to old business, which is the next item on our agenda. So I have 4 items that I wanted to discuss under old business. The first one is accessible healthcare. Bear with me just one second. Okay, so I know we have had this conversation. Last month we talked about it. It came up during our conversation. And I thought what I would do is recap the conversation that we had in February. So it seemed at that point that we had 2 paths of ideas, and that one of those paths was to host an event where people could gather to share or tell stories about their experiences with healthcare accessibility and potentially their experiences with discrimination. And the other path was to set up informative tools for patient advocacy. So what I would like to do in this old business moment is to catch up and see what the board wants to do and maybe solidify a little bit of which direction we would like to take our efforts. So I put that to all of you. Elizabeth, go ahead, you have the floor.
Okay, thank you. This is Elizabeth Dean Clower. I wanted to, I guess 2 questions. One, had we also discussed identifying which of the major hospitals, or I don't know if there's other health facilities that have it, but which have somebody who helps an office like, for instance, Zari's over at MGH, which of the other major medical centers have somebody who's a recognized, I don't know what, the terminology might differ place to place, but that although there's often, the larger hospitals at least have patient advocacy, but then in Mass General's case, Zari has specific expertise for accessibility. And I don't know if there's a way, if Commissioner Makash, if some of that has been collected or available, but I was wondering, that was one question, but in stepping back, is there a way to have, I'm trying to think of either if it's going to be people gathering in a location to, as important as it might be for people to tell their short stories, share their story, but with some, either people in the room who have expertise or some professional guidance on it. In other words, there's components of both I can see rather than having it be either or. I think if people are sharing information but or stories, but without some better, some at least unified way of collecting that information, what categories that falls into, or people in the room who can help direct them towards things like professionals at those institutions or in the community who could help them access that separately. I'm just wondering if, I was trying to remember, with a little more particularity or specificity where we left off in that way, that I think it's important after Dr. Lisa Iazoni's presentation to think of ways to make that experience for people with various disabilities in healthcare settings more accessible in the ways they needed to, but have it be somewhere where it makes forward progress, both for the individuals with disabilities as well as the institutions or offices. Thank you.
So Elizabeth, yes, you asked if I knew of any. I did work closely with BCIL over 10 years ago now. We came up with agreements with Boston Medical Center, Mass General, Brigham and Women's. Tufts was not a part of that, but I'm assuming with such a big hospital as Tufts, they probably also do have someone who pays attention to accessibility. But I know Bill Henning did a lot of work on this with BCIL. I'm not sure if Jerry was involved in that, but Lisa, I believe she's still on the board at BCIL, Dr. Iazoni. And so yeah, I know that Bill has a lot of this information. I don't know I think we mentioned before having him come and talk, but just on one personal note, you mentioned like big hospitals, and it really is across the board, because I had a very negative experience recently, and it was at not even a clinic, it was like a lab. I just went to get like a blood draw, and the access was not good, and the treatment, as far as like non-discrimination treatment, was not good. So it could be anything from like a large hospital, like a mega hospital, like you said, to like a small lab that just has one room. So it really is across the board, but I would recommend, I'd ask Jerry or Olivia, I don't know if you've worked with BCIL on these things, or anyone else, and then really, like Dr. Iazoni said, she's done all the research, so I'll leave it there.
And had her own situation of lack of access. But you're right, I should step back. I guess the reason I still thought of the big hospitals and would be interested to know if the work of Bill Henning and others at BCIL, if there's any update to some of those. Like I could ask about Tufts. I've worked with faculty over there at the medical school, but it doesn't happen to be it's not where I get medical care, so I don't know that status myself at the medical center. But I agree with you. It's often these other offices and clinics and many specialties that even have components that are recognizably going to affect people with certain disabilities. I'll use the example of mobility impairments or people who have some kind of balance issues that, not having any rooms that have exam tables that have a raised lower function. But that anyone with a disability of whichever kind, also needs to have care across the board, not only primary care, but could need to have, skin, dental, vision, any other kinds of these services that everyone needs screening, follow-up, etc. And often there's not any kind of ongoing accommodation made in many places.
This is Wes. Richard, go ahead.
Wes, I think both ideas are terrific and ambitious. I think I recall from a previous meeting that we heard both from Elizabeth and Commissioner McCosh about their personal experiences, and maybe a couple other members of the commission. I think if we can figure out a way to be able to receive a critical mass of public comment, whether it's written or verbal, it might give us enough information to make some recommendations about what various healthcare providers could do. I think we were all pretty much impacted by the report we heard. I've forgotten the professor's name, but it's a real problem. And I think if we can make a dent in it, it would serve a great service to the community.
This is Wes. Go ahead, Jerry.
Yes, thank you, Wes, for bringing this issue up again. I think I was the one who suggested gathering stories from our communities, either in a large group or separately. This was based on a discussion that I had after Dr. Iazoni's talk with both her and separately with Bill Henning from BCIL. The one thing that he did say, a challenge is that a lot of times people do not want to share, maybe because of the intimacy of the doctor-patient relationship, that people do not want to share their personal experiences. So that may be something that we encounter if we decided to do a forum. That's why I did like the idea of having some professionals maybe guide the discussion or there to support folks who do talk. I like either idea myself, getting a forum together or, getting some literature together or I don't remember exactly what the second idea there is, but I would support either one, but I also agree that I think this is a major issue that we could take a lot of leadership on. So.
Thanks, Jerry. I want to echo that. I agree with you also about it being very important, and I think there are going to be some people who are not comfortable, sharing those very intimate issues. And I think that the other suggestion about having, some informative literature available for people, some informational tools. So maybe there's ways for people to fill out some complaint forms or fill out some paperwork to submit their complaints without having to share in such a public forum. That might be a useful tool for them also to get their thoughts out without subjecting themselves to a lack of privacy. Commissioner, go ahead.
Yeah, I just have one quick follow-up question. Elizabeth, when you were practicing medicine, were you in any of the big hospitals in Boston?
Given the nature of my disability, I worked at Dana-Farber in a, not as a clinician, but doing education and research for patients. And that, even there were some problems that I knew I couldn't access if I wanted to go in certain locations. I would need to use certain elevators and not others because there were stairs involved. But that professionally was the limitation of where I was working in my setting. But certainly the way unfortunately, just the way my own healthcare situation has evolved, it's fragmented across the city, partly based on expertise and some physicians moving locations. So I certainly personally can attest that a number of either outpatient clinics or I guess even more of a frame of reference of hospital-based outpatient clinics do not have things, now I'm talking about for people in wheelchairs or who can't stand on a conventional standing scale that doesn't have, would either need a sitting scale or a lift style scale to, for instance, get an accurate weight. That even today in 2023, major hospital departments for things like GI or primary care do not have that capability, nor does dermatology, to do a full body exam. So yes, intimate in the sense, Jerry, of what you're describing, but that really if you're going to do a full body skin check, there are ways that can be done on somebody in a wheelchair who can be lifted onto a table, but you have to have the right kind of lift and the right kind of table, and it doesn't happen. It's not addressed.
Thanks, Elizabeth. And then you raised another good point, like as a doctor, you found things inaccessible as well. And I know Dr. Izzoni and Dr. Blauett probably have experienced that as well. But yeah, I'm happy to work on this as a board if the board members would like to. Thanks, Wes.
And we're switching interpreters. Okay, Wes is saying, Olivia, I think we'll take your question, comment, and then we'll have to wrap this up and move on. Olivia.
It might be useful to rope in the Boston Public Health Commission on something we do, considering they've got the teeth when it comes to hospitals in Boston and clinics and healthcare in Boston. but also I'm thinking of an individual named Nasser or Nicola who is, works at Department of Public Health on disability access.
Do you have the spelling on Nassira, Olivia?
Nassira.
Great.
That's helpful.
Yeah, and Wes is saying, yeah, thank you very much. I was just thinking about Jerry's comment previously, and I guess the board could invite Bill Henning in to come tell us a little bit more about all the ways that BCIL is set up for, people to be able to share their stories. So that might be a good next step for us to maybe host that sort of a forum or some sort of an event that the commission could maybe publish with a list of patient advocates, advocacy materials, and we could share that information widely to the community.
This is Andrea. Yep, I think we can definitely put the invite to Bill and start collecting all the information about those patient advocates together.
Yeah, I think it would be really worth to have their stories, but we also need to make sure that those stories are probably, some of them are confidential, but some of it's really good information that could be shared. Okay. So next I'm sorry, I do see a hand. Jerry, go ahead. I do want to keep going, but go ahead. Yeah, go ahead, Jerry, if you have a question.
Sorry about that. Muting and unmuting again. So I just want to be clear on next step is that you'd like us as a commission to host some sort of community event, or you'd like to bring in Bill first, or how are we moving forward?
Yeah, I think first we should invite Bill in to see a little bit more about how he's set up, how he can talk about hosting your own forum. I think that will be helpful.
I can help with the invitation as well, Andrea, if you'd like.
Okay, great. Great, Carl, thanks. All right, so next I'd like to talk briefly about the movie theater captioning. Sorry, I'm being interrupted here. One moment. My daughter here is wanting my attention. One moment. What I'd like to do is, I think it would be nice if we could have an open caption effort to move forward. And I've asked for some screenshots in order to give some proof that the movie theater seats are at capacity when there's open captions, just to sort of show that that's not an issue. So if someone has some sort of proof, we could capture some screenshots to be able to present that and say, we need to have open captions. We do know that the AMC movie theaters, they already provide open captioning shows. And we do expect that the North Station, the new AMCs, are going to be doing the same thing. I know that there are several months they've been doing them here in the Boston area. But I don't know if the new movie houses, for example, the Alamo Draft House at the Seaport, I just sent a request to them, and I'm waiting to see what they have to say, what their response is, if they're willing to have open caption showings. I was told that actually that some of the Alamo Draft House and other locations are doing these showings, so, but I'm not sure. So it'll be interesting to know if they'd be prepared to do that here in Boston. Also, some of you have asked about open audio description. And yeah, I don't think we have any research that says, that gives us a picture of what's happening. And I don't know if there are any, I don't see any current theaters that actually have this tool. And so I'm not sure if this is worth the effort to try to also include the request for open audio description. I know the city of Boston might want to start requesting this to encourage movie theaters to be including open captioning as well as the audio description. Any comments, any thoughts on that? Let's see. I see Richard has his hand up. Richard? And then I see the commissioner.
Wes, exactly when you're talking about open caption, do you mean the same kind of thing that, we now have in bars and restaurants on televisions? Is that what you're talking about?
Yes, sort of. It's sort of like that. Actually, in movie theaters, open captions means that the captions are open to the movie goers everywhere. So it doesn't matter where you sit in the theater, there are open captions that make the movie accessible for everybody.
So I have a list, I'm sure I could find it, of all the theaters in Greater Boston that provide closed captioning to the hearing impaired.
No, this is different?
Yeah,
right. Closed captioning is a different technology from open captioning. Yeah, it's different. Some movie houses do have closed captioning available, and they provide the patron with a thing called, it's a hand shield. It's like a handheld device that they place at their seat. And for deaf and hard of hearing people to watch the large screen and have this small device with these captions at the bottom, it's really uncomfortable, it's really awkward. It's not what deaf people really want, deaf or hard of hearing people want. They want to have the captions up on the screen, on the big screen. And so I know that AMC they've shown some films with open captions previously.
Okay, so now I understand what you're talking about. Do we know why is there resistance, and do we know why?
Yeah. Well, there's a number of reasons why people resist. Some are shown, some movies do show open captions, and some theaters don't. They don't provide that. And so I think that we need to make sure that the movie theaters do provide some form of access. So that's really the main point. Okay, let me.
This is Carl.
I see. I had identified Commissioner McCosh to go next, but I don't know, Carl. Do you want to follow up?
Yeah, Carl, why don't you go first?
Sorry, Carl. Why don't you go ahead? Yeah.
So I want to partially answer Richard's question. First of all, the Department of Justice requires that all movie theaters have the equipment to show closed captioning. But West is right. Closed captioning is only available to the user who asks for the equipment when they go to the movie theater. The problem that many of deaf and hard of hearing consumers have, and I get email complaints on a weekly basis from members of the deaf and hard of hearing community, is that the staff at movie theaters, because of the nature of the staff being high turnover, don't know how to use the equipment, don't know how to maintain it. It can be awkward, it doesn't often work, where open captioning are like subtitles that are being seen at all times. So that, and I think for many deaf and hard of hearing, it's preferable I will tell you though, and I'm not saying I tend to agree with the deaf and hearted community on preferring open captioning, but I will tell you that the movie theaters will show some resistance because they think they're already meeting obligations under Department of Justice guidelines, and they're afraid of losing visitors who don't want to see the open caption. As far as open audio description, I personally would love it, but I know that's going to be a much harder battle to fight because there is no theater that is currently doing open description anywhere that I'm aware of. But maybe we can ask for other things if we don't win that battle. The equipment often does not work. The staff is not trained. I can't tell you how many times as a blind person I've gone through in the theater and I've asked for audio description devices and they give me caption glasses instead because they're not trained as required by DOJ guidelines and laws. They're not trained, they don't promote it, and the equipment often doesn't work. So even if we can't get open audio description, I do think we should ask that at least a handful of theaters in Boston do train their staff on all the accessibility features, from captioning to audio description to whatever. And it would be very easy for the theaters to be able to do open caption because when nowadays, they download what they call a packet from the movie studios. And in that packet are what's called assets. And in the assets are captioning files, audio description files, in some cases alternative language files. And they simply have a switch where they can flick in their computer settings to say open versus closed. If it's closed, they run that file, and Wesley's right, you get the individual device. If it's open, it looks just like subtitles do for a foreign language film. So I support Wesley's approach. I just think we ought to have a little bit of, this might be a harder ask than the open caption for television, because that was simply flicking on a switch on your TV set on a remote control. This is, the theaters would argue would fundamentally change what they're trying to do. I don't necessarily agree with them. I'm just saying this will be a harder ask, but I do think we should see where it takes us. Then Wesley has pointed out that AMC is already partially showing some open caption titles. I'm happy to send Andrea a link to what the current and existing rules are regarding movie theaters under the Department of Justice, which started in 2016. And we can go from there. And I'd be happy to work with anybody on a subcommittee on approaching movie theaters as far as accessibility of captioning and at least improving the process of audio description.
Thank you, Carl. And I also, the purpose of this effort would be because in other cities and states, they've already passed open caption laws for movie houses. So I was hoping that Boston could be one of those cities. All right, Commissioner, I'm going to give you the floor next, and then we will go to, I'll give the floor to Elizabeth for her comment or question.
Great. I have 3 quick comments. So first of all, when I know, Richard, you mentioned Greater Boston having a list, but we would only actually have impact in Boston itself, the city of Boston proper. And I think somebody mentioned that we only have 2 movie theaters right now in Boston, which is almost kind of sad. But so regarding those 2 theaters, my office has a tool that we use. We call it the Do the Right Thing letter. Since I'm the ADA Title II coordinator and movie theaters would be under the auspices of ADA Title III, I wouldn't have any oversight over movie theaters, but we do have a letter that we send to businesses, other organizations that are not under the city's auspices,
we send these letters just to remind them of their obligations under ADA Title III. So I could potentially compose a letter just to speak to what Carl mentioned, like, make sure your staff is trained on captioning and everything else, talk about the files that they get, the assets. That would be interesting, Carl. I'd like to learn more about that. So, like I said, we send these letters frequently enough, so we could think about having me send a letter. And then, other than that, I also wanted to say that, I had one other thing to say, and now I just lost my train of thought. If the board wanted to vote to write a letter as well. Oh yeah, the other thing I was going to say is we did reach out to the City of Boston Commissioner of Parks and Recreation to ask about the outdoor movies that they show. They don't currently have captions, so we're trying to have a discussion to talk through any ways that we could potentially have those captioned as well. I know that he mentioned off the top of his head a number of barriers that we would have to look at, so we'll have to get more information on that and see what we can figure out.
And we're going to switch the interpreters now.
Okay, this is Wes. Elizabeth, you had mentioned, or excuse me, before we go to Elizabeth, somebody mentioned 2 movie theaters in Boston. Is that the number that we have in Boston currently?
I believe it's Tremont Street and South Bay, 2 AMCs. I believe that's all that's left in Boston. AMC Boston Common.
Actually,
and AMC
you know what?
South
I
Bay.
think AMC will be, as I mentioned, they'll be opening a new location in North Station. And the Alamo Draft House will also be a new movie theater in Seaport. So that means we'll be looking at 4, 2 of which are in the works to come soon. But so that's helpful to know the scope that we're looking at. Just wanted to clarify that point. Okay.
This is Carl. How about the Museum of Science and the Aquarium IMAX Theater?
That's a good point, Carl.
Hold on just 1 second for the interpreter, please. This is Wes. Yes, that is a good point, Carl. Thank you. I would count those 2. I mean, I didn't actually, I'm not aware of other smaller theaters, smaller movie companies, but I think the Aquarium and the Museum of Science are good to keep on our radar. Yeah. Okay, Elizabeth, thank you for your patience. Go ahead.
Thank you. Elizabeth Dinklauer. Just also, what about Coolidge Corner? No, that doesn't count.
No,
I'm
it's
sorry.
Brookline. It's not us.
Yeah,
Unfortunately.
sorry. Yeah, I just realized that after I said that. Yes, I'm going back to your earlier point, Wes. I totally agree with the importance of data, but I don't think that that's going to go over well with trying to have screenshots of full theaters because of issues where people have to sign photo permission. But even if not that many people were showing, or depending on the movie, if minors were if there were children in the audience.
No. Can I clarify? Yes. I'm not talking about pictures in person. I'm talking about people taking actual computer screenshots. If they can see, for example, when people reserve seats in movie theaters, if you can go into the websites to see that all of those seats are reserved, that they're the house is full, but not that all of those tickets are purchased rather than, not going in person to take pictures of people.
Oh, okay. Yeah.
Literal screenshots. Yeah.
Okay. Yeah, that makes sense. I think that would be helpful information. The other, I think the commissioner raised an important point that I think any outdoor venue, those are sponsored by the City of Boston, Commissioner. I mean, that under the auspices of one of the city departments.
Only some outdoor movies. I know a lot of private places, like I know the Lawn on D, for example, they have outdoor movies. I'm thinking like during COVID especially, a lot of places had like pop-up movies. The City of Boston Parks Department does oversee a series of summer films, but I know there are several other outdoor venues that have them that wouldn't be under the city's control.
And do all the ones under the city's control, are those have captioning?
They don't presently know, but we've started the conversation.
Yeah, that I think is very important, and there would be a different level of authority behind it. I think that would be an important starting point. The one thing I'm wondering, obviously what's the most important aspect of the situation is the moviegoer experience for those who have to use the devices that Wesley and Carl have been mentioning. But I wonder, even secondarily, it's of less important, but as part of the, again, not only being inclusive, but having this be the best experience for the entire audience. But I would imagine that as just a secondary lower tier issue, I would imagine it's a little bit disruptive from like a full experience of the movie for people in the vicinity of the people trying to do both. And the only reason I even bring that up is that I know for concert performance venues, they're very strict, not only, of course, not wanting about any recording of concerts, but also just with phones or whatever, the light that they give off. And so I'm wondering, I think there's just so many reasons why it not only makes the experience inclusive and does not take away from the experience of the overall audience. Because frankly, as a tangent, someone was recently telling me that people in their 20s and 30s on their own devices often have the captioning on because they're multitasking and, or in a setting where they want to watch it that way. So again, the most important reason is to have it be accessible for the people who need it to be. But that I wonder if any of the, and especially where the request isn't every showing, but they not only seems like such a reasonable ask. I don't know how many cities already have, or states already have this available, Wes, but just, building on the momentum of what, and I know that's what you're already doing, but I just didn't know if those help at all.
This is Wes. Yeah, Elizabeth, to follow up, I know that Hawaii has passed an ordinance around open captioning. Maryland is actually currently having conversations with the state legislature and hoping to pass something shortly. There are a few cities that on a local level also have open captioning ordinances for films. This is talking all about movies. So potentially more coming on board soon, but those are the ones that I'm aware of.
Okay. Lastly, just to recap, I would say the most important immediate step I can think to take is the one that's the one sponsored by the Recreation Department or whatever city department in conjunction, parallel to the pursuit of the private chains. Thank you.
This is Wes. Thanks for that, Elizabeth. Carl, did you have your hand up? Did you want to make a comment or did you have a question, Carl? Okay. Well, thank you everyone for sharing your thoughts, for engaging in that conversation with me. We can move on to the next agenda item that I have under old business. Bear with me 1 second. So this is actually related. It's the statewide closed captioning bill. I was going to ask Carl to give us an update. If you can let us know where things stand, what's happened since our last meeting.
I'm sorry, can everybody hear me now?
Yes.
Yes, yes.
Okay. So are you looking for an update on the remote participation?
No, I'm asking for an update about the statewide closed captioning bill.
Oh, okay, yeah. So this is Carl, there are two versions of the closed captioning bill. One was written by Senator Michael Barrett in the Senate, and the other was written by Representative Denise, why am I forgetting her last name right now? Denise Garlick. That just like garlic, but there's also a K on the end of it. So, and that's in the House. For whatever reason, they both had the Senate version went to the Committee on Telecommunications, and the House version went to the Committee on Children, Families, and Persons with Disabilities. Not sure why they went to two different committees. Each bill went to two different committees, but they have. To my knowledge, neither bill has been given a hearing date yet, and I will certainly update. I now have the list of every committee hearing for the next 2 years for children, families, and disabilities, but I have not seen the bill assigned to which hearing, and I haven't had a chance to look at telecommunications yet. But I know it hasn't been heard because Senator Michael Barrett promised to keep me in the loop. So, so when I find out, I will be reaching out to this commission to reach out to the legislature through their friends and families and outreach. Because I think because of the precedent that the city of Boston set, that we actually have a more than decent shot of getting something passed statewide.
Thank you, Carl. We appreciate that update. Any questions for Carl before we move on from this topic? Okay, great. Thank you again for the update, Carl. We appreciate that. Next on old business, we had the BPS, Boston Public Schools transportation follow-up. I was going to ask, at the last meeting, we had a presentation. So I was hoping to get some information about that, and I was wondering what the board's thoughts were, what comments might have been about that. My plan was to start us off by asking Charlie to share some information. So Charlie, feel free.
Thank you, Wes. First, I wanted to thank the commissioner and the board for actually having the new director of transportation come and give the presentation. I think the amount of information that was presented as a baseline clearly shows that there are a lot of students, high percentage of students with disabilities that do require and need the yellow bus or the transportation to get to and from school. And they're admitting the challenges that are in front of them. And I believe, and I heard, and I did ask as follow-ups that they did put in new infrastructure to try to help parents communicate more, to have more transparency, and then also more people and infrastructure to make sure that things are getting fixed. So what I would like to ask the board and then also the commissioner is that we, as a commission, if we can, hear updates from transportation on how that is going. Because I think one of the things that that I heard clearly is that BPS is hiring a contractor that does everything from training of bus monitors, to the maintenance, to the busing, to the scheduling, A to Z. And basically, Boston Public Schools is the people that communicate to parents what is going on. So recently, I believe, Commissioner, you had also brought this up in a prior meeting, that there is a non-for-profit legal firm that is representing some parents, and some of the findings that they came up with was that the reports that there is training, that there is active maintenance being done on the buses for wheelchair lifts, that there wasn't any evidence to show and support that there is active training or up-to-date training, and then also active and up-to-date maintenance. So I think one of the things that I had noticed is that when you have one entity doing everything from training to maintenance, to also self-policing and self-accountability, that is hard for one entity like BPS to sit there and check. So I didn't know if it's appropriate to have them kind of report, but then to ask the commissioner, what is it that we can do, or that the commission can do to check in, or to, I don't know if it advise, but really under Title II, it's one of those to check in or to help supplement with compliance. And I think you brought up some great points about trainings, to help with some of those trainings, to help with some of the job fairs. But I think the biggest piece that I hear from parents and some of the students with the wheelchair lifts and maintenance, right? The denial of service because there is a physical problem or a mechanical problem, with that bus. That is one of the things where an entity like the contractor self-policing themselves, I don't think is a good practice, just in general, for the people that are doing the work to also check up on their own work and say that they're doing a good job. So I think it's just, following up with this commission and asking you commissioners, what else can, along with potentially having them come and report on a regular basis, because they will be doing, summer school. And I think the mayor just announced something called the fifth quarter, where they are expanding summer opportunities for students with disabilities and programming for all students, that this transportation issue will be a year-round thing, not just a seasonal thing.
Yeah, so just to respond, Charlie.
Commissioner, I think the interpreters are going to switch. Give me 1 second. Go ahead.
So I don't think I said that there were no training materials, or something you referenced that I said, because we haven't seen any yet, but to my knowledge, they do exist. There is a training in place. We have not followed up since the last meeting, so I can make a note to do that. But you're right, we were going to ask about the training and also about the maintenance, and see if we could get involved in the training, at least review how they train the drivers who work on the accessible buses or operate the lift, see what the training is for that. So yeah, my apologies, I have not followed up with BPS yet, but we'll be happy to do that.
And Commissioner, I apologize if I did. What I was saying is that you had mentioned that, supporting some of the training, because one of the findings from the, I guess, what is known as a problem resolution system that the legal firm that was representing the parents, one of the results of the findings was that the training was actually not happening, right? Even though the busing organization stated that the training was happening. So it wasn't, if I misspoke, and I apologize, I wasn't saying that you had stated that, it was through a finding.
Yeah, I don't have any knowledge whether the training's happening or not, but I will follow up with the presenter who came last month.
Thank you.
Okay, I see Carl has a hand raised.
I'm sorry, that was an old hand raise. I will lower it.
Oh, okay. Let's see. I am, based on what is being asked for, I think that the commission can definitely do some sort of follow-up with BPS on this. So I believe that's a good next step. Now, I also see another hand up, but I want to remind people that we can take public comment at the end during the meeting, so there will be a time for that. And another comment from the Boston Public Transportation. Are there any other comments on the BPS transportation follow-up? Any others? I think that the presentation last month was really great, and it seems that with the new commission being established there that's overseeing the Boston Public Transportation Service, I think, you know, hopefully the issues will be dealt with through that. Okay. I'm going to move on to the next item on our agenda, which is new business. Does anybody have new business? Okay, seeing no new business, great. Now it's time for public input. So this is the time for that. I want to remind the public that you are allotted 2 minutes to ask your question or make your comment. And so we're open for public input at this point. So I'd like to recognize Sulika Soto. Go ahead, you have the floor. Please unmute yourself and go ahead and ask your question.
Hi, good evening, and hello, everyone. Thank you so much for the opportunity. My name is Sulika Soto. I am a Boston Public Schools parent. I have one child that has an individual educational plan, and it's under disability. I have another child who is at Tech Boston Academy, and I'm also a part of the citywide parent council, which represents all of the parent councils within the community. I'm not speaking on behalf of them today, but I would just like to speak about the importance of the accessibility of transportation with students with disabilities. I believe, and I didn't write nothing down, that it's very important for this commission, which I just learned about, to hold Boston Public Schools or everyone, or the folks that are in charge of transporting students with disabilities accountable for the lack of access to equitable education or access to education in general. There are still many parents to this day that are struggling to get their students to school. There are many parents with students with disabilities who have had to quit their jobs or leave their jobs due to not being able to access schooling for their children and having to stay home. So I believe personally that this should really be a priority, and there should be a lot of follow-up to what's happening with our students with disabilities that are not able to access education, because, you know, in the long run is also gonna, you know, push into them not being able to access jobs or not being able to access other things. And I'm not saying that that's what's gonna happen, but if we don't hold or not hold folks accountable, or like, what is going on? Why? Where is the accountability, and why are our students, I don't know how many months now into the year, since September, have not been able to access education in an equitable way, our students with disabilities. Bus monitors and their training, I feel like there needs to be accountability from any government agency that can provide it, to know that bus monitors are being trained, and that there are enough bus monitors, and that they're being paid well for, to take care of our most vulnerable students, and to make it so that they have accessibility to education. So I just wanted to sort of speak on that and the importance of it. If you speak to parents on the ground, they're really struggling, and many folks have to leave their jobs in the middle of the day, or they're getting calls, or like it's a big issue, and parents can't access their jobs. Students are not accessing their education. And there's a really big problem. So I would just ask for this committee to really pay attention to it, and to do the follow-up that's needed, and to get from BPS to ensure that they're following all their IDEA laws and all the laws that make it so that students with disabilities have access to an equitable education. So I just wanted to sort of express that and the importance of it, and I would want to encourage this committee to push BPS and
Salika, if you could wrap, again, we have a 2-minute limit. Sorry, if you could, no, it's fine. If you could just conclude, we'd appreciate it. Thank you.
I'm finished. I'm sorry, it went long.
No,
Thank you
you're
so
great.
much.
Thank
I
you.
appreciate you.
Yes, thank you very much, Salika. We will ask the commissioner, we will make sure that this gets followed up on. We'll make this a priority, so thank you very much for your comments. Any other comments from the public?
This is Andrea. I just also want to make sure if there are any comments in the interpretation channels. I should be able to hear you, interpreters, if you've switched over, but if not, please DM me and I'll make sure I can hear you. This is Andrea. I think we've lost one of the interpreters. I don't know, Rachel, if you can pop in.
Sorry. Yes, Lori seems to have, yes, that's right. This is Wes. Thank you. Thank you, Andrea. I wasn't looking. Maria, I see your hand up. Would you like to comment? Maria, the floor is yours. You can unmute and make your comment if you'd like. Your hand is raised.
Ok. Sim, boa tarde. A mim, não queria fazer só, não queria reforçar um bocadinho sobre o que Suleika Souto acaba de falar. A mim, é um exemplo daquele caso lá. Eu não tenho. Não pode continuar a falar?
So, Maria, if you could please pause. I don't think we have the interpreter.
Anda pausa. Me tem uma criança com Mori com quem? Ok. Pang follow base ou pang da pause?
Maria, can you join the interpretation channel?
Ok. A mim está ouvindo, só não estava verdade, sim. Sim. Não pode falar a seguir ou quando a pausa? Ok. Sim. Sim, só queria falar um exemplo do que Suleika Souto acaba de falar. Como a mim tem uma criança com necessidades múltiplas, então às vezes eu costumo estar falta aula.
I'm sorry, Maria, I don't believe we have an interpreter who can speak your language.
Então, que às vezes se torna muito difícil para mim. Ok?
This is Wes. This is Wes. It seems like we're having some translation issues or some technical issues.
Well, Maria's not in the translation channel. No, I can't hear her. I'm in the English channel. Okay, hold on one second. Okay, this is Andrea. Our Cape Verdean translator, can you try again for me?
Thing is happening, possibly.
Okay, hear her. Great.
No?
This is Andrea. We can hear you now.
Oh, perfect. I don't know what's happening because she was able to hear me. Okay. Because I'm doing, I was told I needed to come to English to speak to you guys when she translated. Isn't that correct?
You are correct. It was a technical error on our end, which we have now rectified. So I will now
okay,
ask
awesome.
Maria to unmute, so you should be all set to interpret. So
Okay,
sorry.
I'll just continue on English then, right?
Yes, please stay here. Thank you.
Okay. I really thought I was doing it wrong. Thank you. Because I was sure she could hear me. That's why I want to double check. Thank you. Alô, Dona Maria, você conseguiu ouvir? Okay, now I cannot hear her. Okay, let me see.
This is Wes. Maria, can you unmute yourself so we can hear your comment? Hello.
Now I cannot hear Miss Maria. Oh God. Yeah, I cannot hear.
Alô? Sim?
Okay. Okay. Yeah, Gostinha pode falar. Nheta pausa, ok?
Sim?
Aham, Nha pode falar. Nha pode falar.
Ah, ok. Sim, desculpa por tudo isso.
Yes, I'm so sorry about this. I just wanted to say a little bit about what Zuleika just finished talking about. Because my son also have disabilities, the difficulty multiple. So then many times he had to miss school because of transportation, and I had to finish to not go to work as well. And that's something that caused me a lot of problems. And a lot of times he had to miss because he had to go to the doctor. And even though I need to do that as a priority, the circumstances sometimes that happens together with the lack of transportation is each time more difficult. And also another problem, the fact that I have to miss work, and that's also a very tough situation. And that's something that, só momento. And also there was something that he had to also get his feeding by a tube, and there was many times that the bus is coming and he's having to be fed by the tube, and she's going to continue.
Sim, que bug costuma estar água no caminho, que às vezes se depois de 6 horas...
And the bus sometimes is broken, and after 6 o'clock he gets home, and that happened last year. And I just wanted to say something to reinforce what Zuleika Soto just mentioned. And it takes many times, so I don't want to take so much longer. Thank you so much for the time.
Mrs. West, thank you very much, Maria, for sharing your concerns. We are very grateful to hear these personal stories. We're going to go ahead and close the public comment section of our agenda. We are short on time, so would like to propose that we close the meeting. Can we get a motion to close the meeting, please? Who would like to make a motion that we adjourn?
I make the motion that we adjourn.
Great. And who seconds that motion? Jerry, I see your
Olivia
hand.
here, I do.
All right, great. Multiple seconds. Thank you very much. All right, all in favor, please raise your hand or signify by saying aye.
Aye.
All right. Thank you. Motion passes. Meeting adjourned, 7:38 p.m. Thank you very much. Good night to all.
Thank you, everyone.
Goodbye, thank you.
Good night. Take care. Thank you.
See ya.
Good night.